Hi friends, I'm back again. As I promised before, I will be doing one video regarding how to transform the case notes. So once you get the OET case note, what all things you have to do? First, you have to interpret what are the information they have provided. If you provide wrong information, it can affect your score, isn't it? And you have to see who is your reader, and the information will be different accordingly. Then next comes the selection of information. You have to select the relevant information and you have to omit the irrelevant information. For the word count purpose, you can use the semi-relevant information. Then next, what you have to do? You have to organize it, which will be in two types, with by order of importance, or you can do by chronological. That is why the visits, how many times he came, the patient, or the time when he presented to the hospital, the admission and until discharge. Anyway, you can communicate it to the reader, but it should be clear and precise. Then here I am going to show some examples how we can take the information from the case note and transform it in a different way. Okay, so let's see. Admission 7/8/2020, name John Dyer, symptoms unsteady gait and weakness. How we can transform it? For example, Mr. Dyer presented to our facility on 7 August 2020 due to unsteady gait and weakness. Another example, Mr. Dyer was hospitalized on 7/8/2020 with the complaints of weakness and unsteady gait. We can just paraphrase it or transform in a different word order. Anyhow way you can do, but should convey the message to the reader. It should be clear and concise as well. I think it's clear for you. Let's see another example. The BP is 140/90. So how we can write it? On examination, Mr. Dyer had a blood pressure of 140/90 mm of Hg. Or we can write in other way, Mr. Dyer's blood pressure was 140/90 mm of Hg. Am I clear? Third one is Ramipril 5 mg daily for hypertension. You can write his hypertension is controlled by Ramipril. We can write currently he is on Ramipril 5 mg daily to manage his hypertension. Then another one, fractured left neck of femur, left total hip replacement. Example, Mr. Dyer underwent a left total hip replacement after sustaining a fracture of the left neck of femur. Then another one, his X-ray revealed fracture of the left neck of femur, for which he underwent a left total hip replacement. Next one, non-ambulatory WBC, that means wheelchair for mobility. Example, Mr. Dyer cannot ambulate, therefore he uses a wheelchair to move. Or Mr. Dyer uses wheelchair for mobilization as he cannot ambulate. I think it's clear for you. Let's move on. And pain relief, Panadol, agitation, rest. Panadol was given and rest was advised. One more example, Panadin Fort, maximum 500 mg for hourly /PRN. PRN means as required. Example, Panadin Fort has been prescribed for pain relief and should be taken as required but not more than every 4 hours. Next, heart attack 2018, arthritis 2015. In history we can see like past medical history. So, Mr. Dyer had a heart attack in 2018, or Mr. Dyer was diagnosed with arthritis in 2015, or Mr. Dyer has had arthritis since 2015. That means still he has arthritis, that is present perfect. Another example, hypertension 2012, and different ways we can write it. First one, Mr. Dyer has had hypertension since 2012. That is the noun form. Then next one is Mr. Dyer has been hypertensive since 2012. That is the adjective form. And third one, Mr. Dyer has lived with hypertension since 2012. So we can write in a different way. So just try to practice it and try to apply in your letter, so you can get your right score. Next one, osteoarthritis, ibuprofen. Mr. Dyer has osteoarthritis for which he takes ibuprofen. This is simple present. So these are some examples which I provided here, and if you find it's helpful for you, please subscribe and like my channel so you can get other informative videos, and please share with your friends so they can also benefit from this channel. Thank you.